late 80s, as part of Governor Schaefer's mental health initiative, at the time there was a lot of thinking about developing local mental health authorities, which we called in Maryland core service agencies, which would be responsible for the planning, development, coordination of services. And it was through those entities that we believed that the local entities were in a better position to determine what the needs of their community were, and then to request funding or to secure funding from multiple sources. And I first met Donna when she applied for a position within the Mental Hygiene Administration. And I was very fortunate in that we were able to hire Donna, who had previously been at Springfield Hospital Center. And she became a wonderful addition to our adult services team at the state.
I first met Donna when I was on the group that was examining and developing the process for implementing the Mental Health Authority in Howard County. And Donna was presented to our group as the final candidate for the position. So I had the privilege of being part of that in the early days when Donna came on as the Executive Director of the Mental Health Authority.
And I've had the privilege of working with Donna over the past 4 years on expanding mental health access in the county, particularly as co-chairs of the Behavioral Health Task Force.
The main purpose of the Mental Health Authority was to plan, develop, and manage services. So we came in and we did the first needs assessment, the first mental health plan for the county. As a result of that, we identified a lot of gaps in services. The first thing that came out loud and clear was the need for crisis services, mobile crisis services. Then it's our job then to develop services to fill those gaps and then to manage those services. So plan, develop, and manage is really the role and function of the Mental Health Authority.
I think Donna realized from the very beginning that she couldn't do it by herself. Nobody in Howard County accomplishes anything on their own. It really takes everyone working together. And by strategically placing mental health services in different places, like the detention center, like juvenile justice, and working on things like all of the continuum of crisis services, working with NAMI, I think that's part of what helped Donna accomplish and realize her vision of creating such effective mental health services in Howard County.
When we were putting together the list of names for the task force, I was so impressed that she knows everybody in this community, and she recognizes that mental health issues touch so many different parts of our community.
And Donna is, she's not just a colleague, she is a partner and stuff, and she's just a get it done person. So I asked Jack Kavanaugh, who couldn't do the taping today, tell me about when things started with him and Donna talking about issues. And he said, here's a good example. A good example is that they were together at some meeting and they were talking about, Jack said, I wish we could get all of the criminal justice agencies, practitioners together to talk about this issue of these folks returning to the community. And Donna's answer was, well, why not? Let's do it. And Donna called for these agencies to come together. This was not a mandate from above. This was, come to the table, we need to talk about this. And the regard that the agency leaders had for Donna, they came to the table. That was 5 years ago, and they're still coming to the table.
I think the two things that I would like to see, if I had a magic wand, would be treatment on demand and less stigma in terms of treating these illnesses. 1 in 4 individuals are affected by mental health issues. So it's a very common disability, but it's probably the most stigmatized one.